This call today is being recorded, and if you are experiencing any technical difficulty, please use the chat for assistance or the help options within Zoom. All lines have been muted. Given the volume of virtual meetings and that our staff is all working remotely in separate locations, we apologize in advance for any network connectivity issues and will do our best to solve problems as they occur. We appreciate your flexibility. My name is Alex Peters, and I am an outreach specialist with the Wisconsin Cancer Collaborative. We really appreciate you all taking the time out of your day today to participate on this call. We are delighted to have so many new people join us today, along with our existing members. Before we get started today, given that the Wisconsin Cancer Collaborative is relatively new to some of you, I thought I'd spend 1 minute providing a brief overview of our work. We are the Wisconsin Cancer Collaborative, Wisconsin's statewide comprehensive cancer coalition comprised of 140 organizations working together to reduce the burden of cancer for everyone in Wisconsin. We connect our members with the tools, support, and knowledge they need to create healthier communities. Our work is guided by the Wisconsin Cancer Plan, which acts as a blueprint for action. The Wisconsin Cancer Plan combines best practices, reliable data, and concrete action steps for health system leaders, public health advocates, policymakers, researchers, and all other Wisconsinites engaged in cancer work. If you are not yet a member of the Wisconsin Cancer Collaborative, we would love to have you join. Membership is free. Visit www.wicancer.org for more information. Let's go over the agenda for today's call. Today's webinar will provide resources and information about routine cancer prevention vaccines and cancer screening amidst the COVID-19 pandemic. We will also have the opportunity to hear how a few members have adapted to our new world with COVID-19 to ensure that patients are still being screened for cancer. You'll first hear from the Department of Health Services on the current state of COVID-19 in Wisconsin. We'll then hear from Alexandra Callweatherer on recommendations for continuing routine vaccinations. After Alexandria, we will hear from 2 members on how their organizations are handling cancer screening. Lastly, we will use the remaining time to then turn it over to our participants for questions as well as a discussion. If a question cannot be answered today, we will do our best to solicit the right expertise and will follow up with answers. We have staff monitoring the chat, and we will do our best to answer questions and address comments. But if we miss something, we will provide a recap in a follow-up email we intend to send out after today's call, along with today's slides and recording. I would now like to introduce Dr. Mark Wagner. Dr. Wagner serves as the Chronic Disease Medical Advisor within the Wisconsin Division of Public Health at the Wisconsin Department of Health Services. In addition to answering questions you may have about COVID-19 and chronic disease, including cancer, Dr. Wagner will provide us with a brief update on Wisconsin's COVID-19 numbers as of Wednesday, June 10th.
Thank you, Alex. So the Department of Health Services continues to provide the daily updates on the number of COVID-19 cases in the state, and numbers are updated as of 2 o'clock every day. The data can be seen at the link found on the slide, and you can also access it by visiting www.dhs.wisconsin.gov. And if you haven't been there for a little while, it would be worth a look. There is some updated information. You can look at a lot of different things by region, you can look at cases by gender, race, ethnicity, talks about our laboratory testing capacity, and also you can just track the cases. But yeah, you can also look at outbreaks in assisted living facilities or other things like that too. So there's a great wealth of information on the website if you haven't looked recently. And I see the slide says as of June 9th, so this was updated right before the numbers got updated yesterday. So as of yesterday, we were at actually about 357,000 negative test results. Our positive test results are, the total number of cases right now are 21,593. Hospitalizations, 2,943. And we've had 671 deaths. And as you can tell from the map here, and as we had expected, I think the last time we talked in May, we were still at 68 of 72 counties with positive cases. And now, as would be expected, all 72 counties have positive cases. So that was just a matter of time. We've also, just comparing since we last met last May, we've had about twice the number of positive results. We were at about 11,000 back in May, and we were at about 1,900 hospitalizations, and now we're up to 2,900. So we've increased a bit there as well. We are also looking at the number of these individuals who also have comorbid conditions such as cancer, and we hopefully within the next couple weeks we should be able to come up with some summary information on that, but the data is still being analyzed there, so there's nothing to release at this point. But we'll continue to monitor this, continue to work with the Wisconsin Cancer Collaborative to address any ongoing concerns and needs for Wisconsinites with chronic conditions and cancer. We'll go to the next slide. As I was saying before, on the website, you can see information broken down by a variety of different categories, and we continue to see the disproportionate impacts on certain communities in Wisconsin, especially the African American community, which sees a percentage of cases and percentage of deaths higher than the representation of that population in the state. So we'll continue to work on trying to figure out how to address those disparities. And I think as far as the data and the numbers, that's where we stand currently. I'll stay on the line until the end to answer any specific questions you have. And if I can't get an answer for you, I can check with someone at DHS, one of my colleagues, and then we'll get back to you. So thank you for allowing me to provide the update today.
Thank you so much, Mark. We really appreciate you taking the time to join us again. Now, switching gears, I would like to introduce Alexandria Co-Weatherer, an outreach specialist with the Wisconsin Cancer Collaborative. Alexandria will be discussing routine vaccinations during the COVID-19 pandemic. And with that, I will hand it over to Alexandria.
Thank you, Alex, and hi, everybody. So routine immunizations aren't something we always directly associate with the cancer care continuum. But immunizations are an effective and important public health tool that help us to protect all Wisconsinites. So patients with inactive treatment are often immunocompromised, thus immunizations for others are important in protecting cancer patients from other diseases such as flu or measles. Additionally, most guidelines suggest that cancer patients receive necessary vaccinations prior to active treatment, if at all possible, to ensure full protection. However, according to the Wisconsin Immunization Registry data, since the start of COVID-19 community spread, routine immunizations in Wisconsin have significantly decreased. And this is a trend that is shared throughout the US and the world. And then in figure 2 here, you can see that this decrease is seen for all age groups, but especially among school-age children. Next slide, please. So you might ask why Cancer Coalition is bringing this up, and here's why. To help protect cancer patients and our communities more broadly, it is essential that we continue vaccinating those who are medically able in a safe manner during the COVID-19 pandemic, especially children and adolescents. Current CDC guidance prioritizes vaccines for children 0 to 24 months of age and pregnant women, while also advocating for continued routine vaccination for other groups when feasible. Further CDC guidance on how to vaccinate safely came out June 9th and will be updated as needed. So first and foremost, we want to avoid another possible and preventable outbreak, such as measles, during or after this pandemic. Also, vaccines generally reduce the burden on the hospitals and emergency room systems, while also preventing pain, suffering, and death. COVID-19 has tested our limits on burdening our medical systems and staff, which we don't want to further exacerbate. We also want to make sure ICU beds are available for those that need them. Vaccines also reduce the burden on our public health infrastructure, so health department staff can spend more time on contact tracing and case management of other diseases such as COVID-19. Vaccines can prevent co-infections. For example, we don't want people to get infected with influenza and COVID-19 at the same time. Hepatitis B and human papillomavirus vaccines help to prevent cancer. And unfortunately, cancer doesn't stop because of COVID-19, and we want to make sure we can prevent cancer when possible. Immunizations remain an important prevention tool for many cancer survivors. And lastly, we just want to be making sure that we can be immunized if possible, so we can protect those who can't due to cancer and/or immunosuppression. Next slide, please. So I want to reiterate that these are unprecedented times, but routine vaccination remains an essential preventative care service for children, adolescents, and adults, including pregnant women, that should not be delayed because of the COVID-19 pandemic. And we know that many of you don't directly vaccinate, so I'll just quickly go over these recommendations, but you can serve as an advocate for cancer patient safety and support your primary care colleagues in their efforts to meet these considerations. So a lot of the current recommendations to continue vaccinating include various strategies to spatially separate sick patients from well patients. So these include things like lowering the number of patients on site at one time, closing a waiting room or registration area and having patients check in by phone from the parking lot, scheduling well visits in the morning and sick visits in the afternoon, and various techniques like that. Next slide, please. Other recommendations include telling patients who are ill to use telemedicine or a phone call, vaccinating during sick visits for minor illnesses such as ear infections, but we do want to delay vaccination for persons with suspected or confirmed COVID-19. Examining patients and giving vaccines by car visit is one recommendation. Referring high-risk adults and pregnant women to pharmacies who can give vaccines at less busy times to keep them safer. And then assessing the vaccination status of all patients at each patient visit and utilizing appropriate catch-up schedules. Next slide, please. And then 2 vaccines prevent cancer, and these are hepatitis B and human papillomavirus vaccine. Interim guidance to prevent mother-to-child transmission of hepatitis B virus during COVID-19 related disruptions also came out. And hepatitis B virus, which causes a liver infection, may progress into liver damage and subsequent cancer. Thus, it is essential that we continue to test, notify, and educate pregnant women about their hepatitis B surface antigen status and vaccinate infants with a birth dose of hepatitis B vaccine and hepatitis B immunoglobulin if indicated. Without these interventions, about 90% of infants born to hepatitis B surface antigen positive mothers could become infected, which could later cause cancer. And then also HPV vaccine remains an important tool and protects against 6 types of cancer in men and women. However, we understand that adolescent vaccines may not be the top priority right now for some people. Even if you are unable to vaccinate, there are still steps you can take to help improve vaccination rates. These may include provider education, reviewing or cleaning up electronic health record data, making preparations for how to handle the backlog of well child visits, following catch-up schedules, which might be something that you're not used to, reminder recall, and working on policy changes such as creating standing orders or new scheduling processes. Next slide, please. And lastly, I want to take this opportunity to remind you that everyone 6 months of age and older should get a flu vaccine every season. We encourage you to start work now to create safe and social distance ways to administer the flu vaccine come this fall. The flu can be particularly dangerous for patients in active cancer treatment. The flu vaccine can protect cancer patients by decreasing their risk of getting the flu, decreasing the burden on the healthcare system and public health infrastructure, and allowing cancer patients to continue their routine and standard of treatment without the risk of decreased healthcare capacity as a result of flu and/or COVID-19. In short, vaccines help us to protect those we love.
Thank you so much, Alexandria. That was really great information. Now, Switching gears, we're going to focus on cancer screening. So COVID-19 has touched nearly every aspect of the cancer care continuum, especially cancer screenings. We will now hear from two different Wisconsin Cancer Collaborative members on how their organizations are adapting and handling cancer screenings amid COVID-19. We will first hear from Dawn Shelton-Williams, a patient navigator for the Wisconsin Well Woman Program at Aurora Family Service in Milwaukee. Following Dawn, we will hear from Alyssa Sprecher, a population health specialist with Access Community Health Center in Madison. Dawn, feel free to unmute your line now and begin your presentation.
Okay, thank you, Alex. Good morning. It's a pleasure to be here this morning. Today I will give a brief summary on how Aurora Family Service, which is part of the Advocate Aurora Health System, patient navigation program, which is called the Wisconsin Well Woman Program, Social Work Navigation, along with our Safe Care Promise, are helping to ensure that women are getting their screenings and in the areas of breast and cervical cancer during COVID-19. So to start off with, we know that there was a dramatic decline in screenings for breast and cervical cancer when COVID-19 hit Wisconsin in March of this year. The Epic Health Research Network in Verona reports that nationwide, breast cancer screenings dropped 94% and cervical cancer screenings dropped 94% also. I would like to start off by actually defining what patient navigation is. Patient navigation is a component of the Wisconsin Well Woman program. And the Wisconsin Well Woman program provides preventative health screening services for breast and cervical cancer to women with little or no health insurance coverage. The program pays for the women to get the breast and cervical cancer screenings. Patient navigation is also a strategy aimed at reducing disparities by helping clients overcome barriers to assessing and completing the cancer screenings for breast and cervical cancer and diagnostic services. Dr. Mark Wagner showed earlier a slide indicating the disproportionately impact of COVID-19 on certain communities. Particularly communities of color, African American, and Latinx. One of the things that the patient navigation program did at Aurora Family Service to ensure that women were still thinking about their breast and cervical cancer screenings and rescheduling them due to COVID-19 is that I went actually back 1 year and reached out to all the patients within the Advocate Aurora Health System and in the community that I had worked with in the program, providing them information about COVID-19 so that they had accurate health literacy about the disease, as well as reminding them about the importance of still getting their screenings in this area. The National Breast and Cervical Cancer Early Detection Program, which is part of the CDC, defines patient navigation as individualized assistance offered to clients to help overcome healthcare system barriers and facilitate timely access to quality screening and diagnostics, as well as the initiation of treatment services for persons diagnosed with cancer. The National Breast and Cervical Cancer Early Detection Program has provided low-income, uninsured, and underinsured women access to timely breast and cervical cancer screening and diagnostic services for more than 25 years. The Wisconsin Well Woman program, the state program, works very closely with this program at the CDC. So as a patient navigator at Aurora Family Service, I work with women within the Advocate Aurora Health System and in the community who are between the ages of 40 years and 64 years of age. I work with them to address those challenges or barriers in which we call the social determinants of health that prevent them from coming in for those screenings. I serve women within 5 counties in southeastern Wisconsin: Milwaukee, Racine, Kenosha, Ozaukee, and Waukesha counties. Some of the challenges or barriers that many of my patients encounter include just anxiety and concerns about getting their screenings for breast and cervical cancer. This dramatically increased during COVID-19. Other challenges include transportation, how to navigate healthcare systems, how to navigate other systems that may impact their lives, such as I've had patients that have been involved with the child welfare system, patients that also are involved with just other community organizations and just not understanding how to navigate within those systems. Mental health issues, family issues, including childcare or caring for elderly parents or other family members. Finances is another area that I also work with patients around. And at times, language. So on the slide here, what talks about patient navigation services, here are some of the services provided by the program. I do a social determinants of health screening, which is a social work assessment and screening for those challenges and barriers that women are encountering that's preventing them from coming in for those screenings or diagnostic follow-ups or even initiation to cancer treatment. Again, helping them navigate the healthcare system as well as community-based systems, care coordination and advocacy. In some cases, I actually schedule appointments for patients and kind of walk them through any concerns that they may have. I also link patients to community-based resources to address challenges and barriers. And during COVID-19, this was especially important because many of the women that I worked with either had lost their job, were experiencing food challenges. So just connecting them to those resources within the community that could help them during this time. I provide health education on the importance of breast and cervical cancer screenings, and also letting women who are within the Advocate Aurora Health System know that patient navigation is a resource to help them. Community outreach is another component for patient navigation services. And currently I am working within the Advocate Aurora Health System with some colleagues within the Cancer Care Department, Community Outreach, and within our Faith and Community Health Partnership Department to explore how we can provide virtual health education sessions to patients within our system and within the community around the importance of cancer screenings. This is currently in the planning phase. Another thing that I do as a patient navigator is I provide emotional support. For many of the women I work with, it's just listening and being present to them to hear about the concerns, the challenges that they are encountering on a daily basis, and working with them to develop a individualized plan that will help them resolve those challenges. So I would like to share with you just 2 examples of what patient navigation is. So patient navigation actually in work. So pre-COVID-19, I worked with a patient who was uninsured. She was married. Her husband had a good job, but unfortunately they could not afford the insurance premium from his place of employment. And she wasn't eligible for the state Medicaid program. So I assisted the patient who needed a breast cancer screening by navigating her to our Wisconsin Well Woman program agency in Milwaukee. The Wisconsin Well Woman program site coordinator worked with the patient to enroll her in the state's Wisconsin Well Woman program, and she received her mammogram in early March of this year. I continue to work with the patient to work on helping her to get health insurance, full coverage. So I connected her to Aurora Family Services Public Benefits Program, and she is now working with the case manager that will help her get full health care coverage. During COVID-19, I assisted a patient who had discovered a small lump in her breast. She had went in prior to the COVID-19 really starting, and her doctor had actually ordered a diagnostic mammogram and ultrasound for her. My patient has a history of other chronic medical conditions and was very concerned about going into the hospital or clinic during COVID-19. So I listened and processed with her anxiety about going into the clinic and provided her information about Advocate Aurora Health's safe care promise to our patients and our staff. So during COVID-19, Advocate Aurora Healthcare is committed to keeping patients and staff safe by taking extra steps to ensure safe care. This includes a virtual check-in, our screening process. So there is a COVID-19 screening questions that are asked of the patients prior to them either entering the hospital, the clinic. Temperatures are taken. We also have masking. If a patient does not have a mask, we will provide a mask. And we have rearranged our waiting areas and staggered appointments to adhere to the social distancing. And finally, we have enhanced cleaning. So there is also additional disinfectant for high touch spaces. And then we have hand sanitizing all over the area. So this is just a brief summary of what patient navigation services are and how Aurora Family Services patient navigation program and Advocate Aurora Health are ensuring that low-income women, whether they have insurance or are underinsured, are getting their screenings in the area of breast and cancer screenings. Thank you very much. And this is my contact information.
Thank you so much, Dawn. That was really fantastic. We really appreciate you taking time out of your day to join us and share your expertise and information. So now I would like to introduce Alyssa Sprecher, Population Health Specialist at Community Health Center, to Access Community Health Center in Madison. Like other health centers, Access Community Health Centers dramatically changed their day-to-day operations to respond to the COVID-19 public health emergency to keep their patients and staff safe. Alyssa will be sharing their plans to restart offering colorectal cancer screening for their patients. Alyssa, go ahead and unmute your mic and feel free to start your presentation.
Perfect. Thank you so much. Okay, so you can go to the next slide. So currently, I just kind of wanted to give you guys a viewpoint of what our current clinical operations look like. So starting on May 26, we started opening up to essential care in medical and dental. We originally had our respiratory clinic located at our Joyce and Marshall Erdman Clinic on the south side of Madison. And on that May 26th, we moved our respiratory clinic to our William T. Evu Clinic on the east side of Madison. This site offers respiratory care, essential medical care, behavioral health, dental, and pharmacy services. Erdman was then opened up for essential care, behavioral health, dental, and pharmacy services as well. We also have some needed staff within the clinics, like our Spanish medical interpreters. They're located in our administrative building right now to conserve PPE. And then we also have some of our community resource specialists located at our administration building as well, as they work on specialty referrals and outreaching to patients to help them apply for services over the phone. You can go to the next slide. So this is kind of just our proposed plan moving forward. We haven't gotten to that point yet. We're going to do a pilot, which I'll talk about later, but just kind of looking at our patients from our pay-for-performance contracts with our payers, and looking at those individuals at average risk for colorectal cancer and who are due for screening. And so that's kind of just like the small subgroup that we're going to concentrate on then to potentially start doing some overall population outreach if this goes well and as we see capacity. So this outreach, so our support staff would be outreaching to patients overdue for screening on our pay-for-performance contract list. And if patients are agreeable to be screened, the support staff would then mail them a fit kit. And then that workflow is on the next slide, but we'll get to that after we talk about this. And what we did was just to kind of see the cost benefit. And as we looked, the benefit was actually, or the cost of mailing the kits were very low. And so we said, you know, why not? Looking at our patients that are overdue based on all of our contract lists, it looked like 568 patients. And as we think about outreaching to patients, most of the time you only get a hold of about 30% of individuals that you call by phone. And so that is only $340 to mail kits to patients, saying that we would only get a hold of that number of people. So we thought that it was a relatively low cost to be able to send kits to patients until further notice. You can go to the next slide. So this is kind of our workflow, and I mapped it out that as a patient is identified from our list, which I was able to generate from Azara drives. We have our list from our pay-for-performance contracts, but there's a filter there that I can use to show by payer as well. And so I'm capturing all those individuals. And I can also look at them by like when their last appointment was. So to kind of prioritize patients, that would be more receptive to screening. We are starting to look at patients that have been seen within the last 18 months to 2 years. Because anybody seen over 2 years, they probably need some sort of other outreach before we call them to talk about colorectal cancer screening. So once the support staff references health maintenance and care everywhere to confirm that they are indeed due for colorectal cancer, they're going to do that within the patient's medical chart screening. And then the support staff is going to call the patient or send a message in my chart. Some of our patients prefer communication through my chart, which is great. And so they can just send them a inbox through that. You can go to the next screen. So then if the patient is agreeable to be screened, they're going to place the order. Basically, this whole workflow is the same as if the patient was in clinic and they gave them the fit kit at the time of their office visit. And then they're going to go ahead and inter-office the kit with the addressed envelope for postage to be added and mailed to our administrative building, so we can keep track of how many kits we're actually mailing out. If the patient isn't responsive, they're going to go ahead and just make note of that in the chart that they did try to contact the patient, and then make a note on the outreach list that that they were just going to mail them a kit at a later date, or follow up with them with a letter. And then if the patient is not agreeable, we're just going to postpone the fit kit topic in health maintenance for 1 year, and then also make note that the patient, that we called the patient and they weren't agreeable. I will have to update that workflow. It looks like it's incorrect. So you can go to the next slide. So before we do this kind of overall outreach to, almost 600 patients, what we were going to look at is doing kind of this cold mailing to a sample of patients. And so what we've identified first is we're going to start with a 20 patient sample from our courts pay for performance list, ages 50 to 75 at average risk of colon cancer and due for screening. What we're going to do is we're going to cold mail these kits to these 20 established patients from our outreach sample with a letter / infographic from our clinic. The kit, again, will have instructions on how to complete it, as well as information from Access on why they're getting the kit. Then we're going to follow up with them after 14 days of it being received. And so this initial assessment will help us determine if we need support staff to make calls, or if we can, based on our theory of patients already being established, can we just cold send fit kits and then follow up that way? You can go to the next slide. So this would be the letter or like infographic flyer in the kit. And it's just kind of talking about what we're doing as far as COVID-19 and how we still want to meet patients' needs. But if you don't have to come into the clinic, we'd rather you stay at home, which I am sure a lot of people would rather not come to the clinic right now. Anyway, and so how can we meet their needs of making sure that they're getting those preventative screenings at home? And so again, this just provides some information to them, and they can give us a call if they don't understand the instructions on the kit, and or they can give us a call if their medical chart was incorrect and they actually were screened. And so then we can update that as needed too, if it wasn't in our system. So this, again, we haven't started any of this, but this was kind of just our initial process, and we would definitely have more information within the next month how our efforts have gone. We thought that colorectal cancer screening was a good measure to start with, because it is something that people can do at home without coming into the clinic, but yet they're still getting that care that they need. You can go to the next slide. And this is just my contact information if you have any questions. I would be happy to answer them.
Thank you so much, Alyssa. That was really great information. I know that will be helpful to a lot of people. Now, moving on to our last section, our Q&A section, I would like to hand it over to our partnership manager, Beth, to facilitate this. So feel free to use the chat box to submit questions now.
Great, thank you, Alex. Before we get started with the question, we just had one comment from Dr. LeConte, who said that most cancer centers are going to be able to vaccinate for the flu this year. So in case you were on the phone today and not seeing the chat, Dr. LeConte mentioned that when a patient comes in for an appointment that they're going to be able to also do a flu shot, even though it's not primary care. So thank you, Dr. LeConte, for that note on the earlier presentation. And thank you to our presenters today. That was fabulous information, and we know so much is changing over the past couple of months. So hearing how adjustments are being made just to meet the needs of everybody in this space of cancer prevention and screening, really helpful information. Thank you. We do have a couple of questions. So one that came in, I believe, is directed to the presentation from Access, is where is the funding coming from for the test kits and the lab processing costs?
Yeah, so we have some grant funding that we got from, what was it? Well, first it was through the Carbone Cancer Center, and then we received some additional funding through, maybe it was through the Wisconsin Cancer Collaborative, but we received grant funding nonetheless. Of course, all the grants, I can't keep them all separated, but we have grant funding, some grant funding left that's covering those costs. Also through LabCorp, they have worked with us for, our kits already have a mailer to be mailed back, and that has a business reply and business prepaid postage on it that is also covered through our contract with LabCorp. So we would only have to pay for that initial cost of sending it to the patients. So that's how we've been paying for that's how we are going to pay for the mailing. And then also, what was the other questions for positive fit kits? So positive fit kits would still follow our process that we've been doing, pre-COVID. So an RN would follow up with patients who have a positive fit and kind of talk through what that means, as well as what their next steps are, which would be a diagnostic colonoscopy. And from my perspective, I think the last time that I talked to somebody through UW who we sent most of our patients to for colonoscopies, they were seeing patients for diagnostic colonoscopies, and for screening colonoscopies, they were only seeing patients who had like needed follow-up. So it was like 1, 2, or 3 year follow-ups. So and then they would be doing at the point, like I think it was 48 hours before their colonoscopy, they would need a COVID test. And so they would just be getting those through UW, or if the patient needed to, they could get it through Access as well. And then I think the other question was around collecting data around cold sending kits. Yes, we're definitely going to be collecting data, since this is a relatively large number of people that we, hopefully plan to. So the 20 we're going to start with, but if we're doing really good with that, we are going to expand that. And so we would have a relatively high number. So we're definitely going to keep track of that. And that is something that I could definitely share with you guys, like I said, in the next month or two, once we have some more results of how that plays out.
Great, thank you. I think it's fascinating data, not just for this pandemic response, but also just in general. And I think Regina mentioned that it could be a game changer in how to get individuals screened for colorectal cancer. So thank you for sharing. And we'll be very interested in hearing the results and how that process takes place. So thank you.
For sure. Yeah. And what we've noticed too, just through this pandemic, and it might be generational too, that people, what we've realized is people really like doing telemedicine if they don't have to come into the clinic, and they can just do it through a phone call or through video. They would much rather do that. And you know, colorectal cancer screening could be one of those things, one less thing to have to actually come into the clinic and just be able to do it from the comforts of their home and send it back. So yeah, hopefully we'll have more information to share with you guys in the coming month.
Great, thank you so much. I have a question, I think, kind of to the entire group of speakers that we have. So Matt, my buddy from ACS, has asked, really, what can non-clinical staff do from organizations such as the American Cancer Society and probably our other member organizations to promote screening and vaccination during the pandemic? So great question.
I can speak to the vaccination piece. So I really think just reinforcing the message that routine vaccinations are an essential service, because a lot of people haven't been thinking that the last couple months, understandably. And then also just sharing resources about how you can get safely vaccinated, or what health systems are doing to protect their patients. So I know there's a repository of resources from the Immunization Action Coalition, which is included in the resources at the end of this PowerPoint. And then also just spotlights of what other people are doing, and getting vaccinated yourself and normalizing that conversation. So when I get my flu vaccine, I tell everybody, and I talk about that, just like dinner conversations, just trying to really normalize getting vaccinated.
Great, thank you, Alexandria.
Hi, this is Dawn. I can talk from the breast and cervical cancer screenings. I think what Alexandria was saying about normalizing it, the normalization of the importance of screenings, sharing that with their clients. And I think another important aspect has to do around the health literacy piece, really ensuring that you know, clients really, you know, understand the importance of getting the breast and cervical cancer screenings. And if you're providing materials to client populations, you know, make sure that those materials are really fit for targeting those populations, and being also mindful in regards to kind of reading and writing literacy with sharing the information around the importance of the screening. Also, I just wanted to add into this, because I think this also connects within the community. The question was the importance of faith-based community and the support system and building trust for outreach and screening in certain populations. This is extremely important in regards to where many people get their support and who they trust within the community. And faith-based organizations have been kind of the grounding and the root in many communities. So reaching out and establishing partnerships with those faith-based organizations is extremely important, because then they're also disseminating the information not only to their members, but if they have programs going on at their institutions, they also can then provide information there as well. Thank you.
Thank you, Dawn. I think you brought up a really important point that as we look to our communities, the faith-based part of our community is so important. You know, really, those are trusted members, almost of our family, as to what we look to as the faith-based leaders, plus the other members of the congregation. So yes, great point that that would be a place to go to really help build that trusting relationship in a community around vaccinations and screenings and healthcare. Thank you. If you have any other questions, please continue to put them in, but I had one additional one that I just wanted the thoughts of our presenters today is, do you have any recommendations for what we as a collaborative could do to help individuals get back into screening? You know, are there things that we should look to as a collective group? Are there ideas or thoughts that you could share with us, not just as individual members, but, you know, is there something you see us coming together and really helping to reassure individuals getting screening, getting back to screening, getting back to immunizations? Any thoughts you had on that and how we could help?
Hi, this is Dawn. One of the things that I've been kind of thinking about, and maybe this is an area where the collaborative can assist, noticing, well, with the new way that we're doing things, I guess our new normal, really to connect out to the community, maybe through some type of well, social media and like text campaign, where just an easy message just comes across in regards to, did you get your screenings or vaccinations, with, you know, brief reasons why to do that. That may be one way of engaging the community, and then also reminding about the importance of the screenings and vaccinations.
Great, thank you, Dawn. Excellent point. Well, it looks like we have completed all of our questions and comments, so I am going to turn it back over to Alex.
Thank you, Beth. So before we wrap up today, we just wanted to make you aware of a couple resources that we have on our website. We do have these how-to sheets available that are great when you are working with patients. These were developed in partnership with Covering Wisconsin to try to make them as health literate as possible. These how-to sheets offer straightforward answers to questions about cancer risk, screenings, and insurance coverage so that patients can make informed choices about their health. You can use these tools to start important conversations with patients, families, and community members who may have health literacy differences. And these are also available in Spanish. Also, we have added new social media tiles to our COVID-19 and cancer social media toolkit. So make sure to check those out. You can find them at the link below. And then lastly, registration is open for next month's webinar on July 9th. It's going to be COVID-19 and cancer risk reduction. So how has COVID-19 impacted cancer risk reduction behaviors like healthy eating, physical activity, and alcohol use, for example? Join us as we take a look at some of these behaviors with a special emphasis on how alcohol use impacts cancer risk and how Wisconsin's alcohol landscape has evolved in the midst of COVID-19 pandemic. You can register for that at the link below. And then finally, here are some resources. I know Alexandria mentioned one of these earlier, so you can follow these links to those. And that concludes today's presentation. Thank you all for joining. We hope to see you next month.